Okay, this is a fall protocol that I like to work with my geriatric population. And I say this is not necessarily a fall prevention protocol. A lot of us are going to fall throughout our lives. The problem is not so much the falling, but falling well and getting up from the fall. So for a lot of my geriatric population, the sequencing is important. All right, so practicing this as an intervention and to both sides, do to the right side, do to the left side. Then hopefully when you're not around as a practitioner, if somebody falls down, they can remember your little voice in their head for the sequencing on how to get back up. So to go down towards the floor, first I say coming into a stagger stance. So it's like a small lunge. When you put one knee down on the floor, put your knee down in alignment with the arch of the foot that's in the front. For people who can't go all the way to the floor, you can have something nearby, a stool, a chair, something to go down, sometimes even yoga blocks. Okay. Once you're down on the ground, you bring the other knee down to the ground, shift both knees to one side, and rotate the hip down to the ground. Bring the underside arm in close to the body and slow the descent with the elbow pushing into the ground as you come down onto the shoulder. Right? Then the fall continues. Right? You roll back onto your back. Help, I've fallen and I can't get up. Right? And then you reverse the sequencing. So some of my geriatric population, they try to come up from here and just get up. And they don't have the core strength to come up from there. So you reverse the sequence. Rotate back onto the shoulder, either side, doesn't necessarily matter. Push off the elbow and the palm to come back up to both hands. Then can rotate back up with the hips to bring both knees underneath you. Bring one foot forward in alignment with the knee, perhaps grabbing onto something nearby to come back all the way up to standing. Repeat to the other side. You can go left, you can go right, as many times as your patient will tolerate. Thank you for joining me.